Hey everyone, thanks for watching. I want to talk today to you about a condition called delusional parasitosis or Ekbom syndrome. And that's something that you're going to come across. I know I've come across it a few times. When you start looking for Demodex blepharitis and treating that and talking to patients about what this condition is, you may get known for looking for that. You may start to see some of these patients who are actually delusional about their condition. So there's a difference between having it and feeling these mites and then not having it. I did have a patient come in who was convinced that her house was infested. She brought in pictures of rashes and it showed me, what you want to look for with these people is they'll have a matchbox sign. So they usually bring in something to prove to you that they have this condition. They've often been to many other doctors. This is actually a real psychological condition, and you need to refer this patient probably to psychiatrists if you can get them to do it. But that's going to be a challenge because they've been told for years by doctors that they don't have anything wrong with them. It's all in their head. They don't believe it. They're convinced they've got a problem. So that's delusional parasitosis, and it can be treated with psychotherapy and antipsychotic medications. Different from that, when you talk to patients and you tell them that you've got Demodex blepharitis and you explain what that is, I think you need to have some level of caution with that. Explain that this condition is very common. We see it. I see it in about 30% of people who walk through my door, some evidence of this. And I explain that if you're over 18, you have some of these mites on your body. Everyone has some. They live in oil glands and hair follicles. But in your case, you just have too many. So I'm going to try to help you get that under control, get the population back to normal. We do that with lid hygiene most of the time, as you know. Tea tree oil based, I think, is the best way to go. But counsel that patient. This is a normal condition. You're not going to see them. They're not going to really feel them. They'll tell you sometimes they feel them. Worst case, I had a woman who shaved her head and shaved her eyebrows and was convinced that she felt them crawling all over her head even after we had treated her and got her all cleared up. So what I did with her is I took pictures of her eyelashes and showed her everything's normal. I actually pulled lashes and put them under a microscope and showed her there's no more mites there, although I'm sure there were some. They just didn't turn up. But I think you have to have read the patient a little bit. It's not smart to freak patients out about this condition. It's so common, and I don't want to call it benign. It needs to be treated. It causes inflammation and a lot of untoward effects, but it's not going to cause them to lose their sight or anything like that. So I counsel my patients again that this is a relatively common condition, and we're just going to treat it and keep it pretty low key. And I don't really show patients microscopic pictures anymore. I will show them anterior segment photos and the base of the lashes, or I'll refer to a poster or a picture and say, this is what you've got and here's how to control it. Let's just move on to the next thing. So have some level of caution when you do that.